Health Healthcare disparities inside the African American community. Most African Americans have minimum or no medical coverage. African Americans are 1.5 times more likely to be medically uninsured. In 2022, 10% of African Americans were uninsured. This is because of high insurance rates and poverty. Most African American families only have one main provider in their household, which creates a struggle for them to afford medical insurance. Limited access to healthcare providers. African Americans typically have limited access to healthcare because of them being uninformed of what is available for them. Some providers will not accept low income patients, and this leaves them uncovered and medically untreated. This means they have a worse health status than other other races, such as white people in America. Most times, African Americans cannot do not qualify for Medicaid because they are said to make too much at their job but still can't afford monthly bills plus insurance. Social and economic challenges that African Americans face. African the most social and economic challenge that African Americans face is poverty. As I said, most black families only have one main provider and often struggle with monthly bills. So this leaves little to no money left over to afford medical insurance. And quite often, these same families have too much income to qualify for Medicaid, which is only accepted in certain places. African Americans face racially biased healthcare treatments and providers. Most often, black people are prejudged and treated unfairly because of their appearance or their skin color and where they come from. These are the workable solutions for healthcare disparities. Raising awareness. By educating providers on the disparities that black people face and offering training exercises that can help the providers be more competent and informed when treating patients who are African American, the process can begin to reduce these disparities. Improvement of, oh, that's a typo. It's supposed to say improvement of data systems. Sorry. Providers and the medical institution they work with can create a system that can track how often and where these disparities occur within healthcare. Working with the community to help reduce racial disparities can also help this process and eliminating these disparities. Also, effective communication is very important when it comes to bettering our healthcare systems for everyone, including African Americans and the providers who are treating them. Increasing access to the providers. Most often, black people have a harder time relating to the doctor or nurse treating them because of ethnic differences. By hiring more providers who have similar backgrounds to the patients that are being treated, we can close the gap and of these disparities and healthcare to make a better system for everyone. Build better relationships. As history has shown us, the relationship between the patient and the provider, when the patient is a minority, there is a distant between the two. The patient and the provider can work together to create solutions that work efficiently for all parties involved. Providers can ask patients about their previous experiences with healthcare and healthcare providers to further avoid these previous experiences that were not good. The provider can actively listen to the patient's concerns. Most often, the provider doesn't fully listen to what the patient is saying that they think is wrong with their health. By doing this and listening correctly and actively, we can better the health system and it will be a better outcome for the provider and the patient as a whole. Reducing legal and policy barriers. Eliminating coercive practices such as compulsory admission, involuntary medication, and impinging on individual autonomy. By doing this, we can eliminate more of these barriers for African Americans and provide a better healthcare treatment for African Americans, and respecting patient rights and confidentiality. Most times the main problem with the patient and the provider when it comes to African Americans is the trust. We have a hard time They have a hard time trusting the provider because of their past experiences with providers who didn't really care about their well-being. And these are the references where I got this information from, and I hope I gave a lot of good information, and we all can work together to make a better healthcare system for everyone.